Right, folks, welcome to lecture number 2 for our anatomy, physiology, and terminology. This is the second of our sort of baseline lectures for setting a foundation for how we talk about the body before we go into our actual anatomy and physiology. So this lecture will be going over some body organization. How do we talk about different parts of the body? How do we talk about things like cavities within the body? We'll look at a little bit of cell biology. We'll look at some of the medical terminology that you see surrounding diseases. And then we will take a look in the second half of the lecture at our medical terminology that we use for talking about parts of the body. How do you say that something is closer to the center of the body? How do you say something is closer to the head or closer to the feet? And I will be the first to acknowledge that this can be a bit difficult to conceptualize when you don't have, an example in front of you, say a mannequin or a skeleton or something like that. So I have posted links to a couple of videos that go over directional terminology that I think will help you better visualize what we're going to talk about. So with that said, let's get started. So our objectives for the first half of this lecture, as always, if you are comfortable with these objectives, you should do very nicely on the quiz that goes over this. So let's start with some cell biology. A cell is the basic unit of all living organisms. Everything that is alive is made out of cells. You, your roommate, your dog, your cat, the fish in your aquarium, the tree outside your window, all of these are alive. All of them are made up of cells. Some organisms are only made up of one cell. Think of something like a little bacterium, for example, or a little parasite. Viruses are not cells. Viruses are big in the news right now with our COVID-19. Viruses are not cells, and if you want more details about why they technically don't count as a cell because they're technically not alive, feel free to ask. So a cell is a basic unit of all living organisms. And when we talk about living, there are a lot of categories that we can use to classify whether or not something is living. Does it take in nutrition? Does it make waste products? Does it respond to its environment? Does it reproduce? Does it eventually die? All of these are actions that living things carry out, and cells carry these out, which is why we classify them as living organisms. Metabolism is the biggest way that we would classify whether or not something is alive. Metabolism, when you think about it, just generally speaking, you usually think about like your metabolism. I need to get faster metabolism, how much energy I'm burning, that sort of thing. When we talk about cells, metabolism is simply all the chemical and physical activities of the cell. And I would know that definition for the quiz. Everything that the cell does is its metabolism. So if this was, say, a little beta islet cell that is hanging out in your pancreas and it's making insulin, that is part of its metabolism. If it is a little white blood cell that's chugging through your blood and grabbing viruses and grabbing bacteria and destroying them and denaturing them, that is part of its metabolism. All of its chemical and physical functions are its metabolism. The energy that a cell generates is called ATP, adenosine triphosphate. You don't need to know the big name, but I would have ATP kind of bouncing around in your back of your mind when we talk about this. Some of the poisons that we find in nature actually work to block this production of ATP. And if this happens, your cell doesn't have any energy. And if your cell doesn't have any energy, your cell will die. And if your cells all die, eventually you die as well. That's why some of these poisons do this. Cyanide is an excellent example of that. Cyanide gas blocks ATP production in your cell, kills off your cell, and then eventually kills off you. When we look further into cells, we find organic compounds. Organic means different things in different contexts. Generally speaking, when my students think of something organic, they're thinking of something that costs, $5 extra in the checkout line at King Soopers. Something natural or healthy or good for you or grown without pesticides, whatever the definition may be. When we talk about biochemistry, organic chemistry, cell biology, organic means something that has carbon. Carbon is one of our basic elements. It's kind of the element on which everything else is built. So organic compounds contain carbon. And there are three main organic compounds. There are proteins, carbohydrates, and lipids. Within the cell, proteins do a bunch of different things. Proteins can be enzymes. An enzyme is a chemical that speeds up a reaction, but is not used in the reaction in that process. Proteins can also make hormones. Hormones are chemical messengers that allow your brain to communicate with different organs in your body, that allow different organs in your body to communicate with each other. A protein hormone would be something like oxytocin or insulin or glucagon. And then proteins serve as structural materials as well. Specifically, they serve as little pores in the cell membrane that allow stuff to enter and exit the cell, kind of like a little gate. Carbohydrates are found in two main forms. Sugar is the main energy source for just about any cell, and the sugar of choice for your cells is glucose. This is what your cells prefer. Now, if they're given other sugars, they can convert those into glucose. You also find starches in cells. These are also used for structural materials. Some cells are coated in a little sugary coating. They're kind of saturated in that. And as is the case with anything that's coated in sugar, this makes these cells sticky. So take a minute, pause the slide, think about why would a cell want to be sticky? So the reason why we see cells coated in sugar is because that makes them stick to things that they want to grow on. So imagine, if you will, that you are a little streptococcus bacteria, and you are going to colonize somebody's throat and give them strep throat because you got nothing better to do. If you are coated in sugar and if you're very sticky, you're going to have an easier time sticking to that person's throat. Think about all the things that go down your throat: hot liquids, food, maybe your pencil eraser, I don't know. If you are a sticky little bacteria, you're going to hold on to that throat better, colonize it better, and have better success growing and, unfortunately, eventually giving your patient strep throat. The last of our organic compounds are lipids. Lipid is just a fancy word that means fat. Lipids are found in two main forms in cells. They also produce hormones. Hormones that are made from fat are called steroid hormones, and the majority of steroid hormones are made from cholesterol. You do need cholesterol in your diet. This is why your liver actually makes cholesterol. Now, when we think about steroid hormones, what is the first thing that comes to mind? Some disgraced sports figure like crying on national TV, "I'm very sorry that you caught me shooting up drugs. I promise you'll never catch me shooting up drugs again." And those are anabolic steroids, which are a legitimate form of steroids. They bulk up muscle. But when we're talking about not sketchy steroids, we're talking about things like sex hormones. Estrogen, progesterone, testosterone. Cortisol is a steroid hormone. Aldosterone, which helps you with your salt and water balance in your body. Those are all steroid hormones. They're made from cholesterol. And then lipids also play a role in forming the membrane of the cell. We talk about a phospholipid bilayer. This is just a little fatty membrane of the cell that keeps water in the cell, keeps it from leaving the cell, but also keeps too much water from going into the cell. So those are our main organic compounds that we find in a cell. If we were to look inside a little cell, you would see that it has a little brain in the center of it. This little brain is called the nucleus. And the nucleus carries genetic material. And this genetic material is DNA, deoxyribonucleic acid, usually the first great big word that you learn to say in science class in like 4th grade. DNA, strands of DNA are wound around themselves to create chromosomes. And these chromosomes carry different genetic material. You have 46 chromosomes in every cell in your body, with the exception of sex cells. So sperm and egg cells only have 23. They have 1 copy of each pair, while all of your other cells have 2 copies. And this is because when those sex cells merge up, when an egg and a sperm cell come together, you get 1 copy of each chromosome from mom and from dad, and that's what forms this new individual. Now, genes are specific sections of that chromosome, and these control formation of enzymes, formation of proteins. This is how your DNA tells your body how to make you. This is the blueprint for making you. When we talk about genetic diseases, this is what we're referring to, little sections of DNA on a chromosome that have been damaged in one way or another. So say, for example, you are working up at Children's Hospital and you have a little baby that just came in that was just diagnosed with cystic fibrosis. When we talk about cystic fibrosis, we're talking about a specific little section of DNA on chromosome 7, the delta F508 mutation that has been broken, that's caused that genetic abnormality. So that's what we mean by genes, tiny little parts of DNA in a chromosome that code for something specific. Now, moving on from cells to tissues, if we get a bunch of cells, a bunch of the same type of cells together, that forms a tissue. There are 4 basic types of tissues in the body. I would absolutely know these 4 for the quiz. The first type is epithelial tissue. Epithelial tissue is found on the outside and the inside of everything. So take a minute, look at your hands, look at your arms. Your skin is all epithelial tissue. If you go in the bathroom, open your mouth, look at the skin, the tissue, the membrane on the inside of your mouth, that's epithelial tissue. Epithelium also lines the inside of all your organs. So if you were able to take your heart out and cut it open, don't do that, you would see the inner lining of the heart. That is also epithelial tissue. There are 2 types of epithelial tissue, simple and stratified. Simple epithelium is just one flat little row of cells. Imagine if you took a bunch of pancakes and laid them all next to each other. Simple epithelium is found in areas of the body where we're absorbing substances from one system to another. And a good example of this is in your intestines. Your small intestines are lined with simple epithelium because we are absorbing nutrients from the inside of the intestine into your bloodstream. Stratified epithelial tissue is found places where you need protection, and the inside of your mouth is a good example for that. Think about everything that goes into your mouth on a daily basis. Food, drink, hot beverages, spoons, forks, maybe you're licking off the knife. You want to protect the tissue inside your mouth. Also think about the last time you bit the inside of your cheek when you were chewing. Probably it hurt, but probably you didn't bleed out. You didn't have to go to the ER because you're bleeding out from your mouth. And the reason for that is because the epithelial tissue inside your mouth is stratified. It's lots of layers of cells stacked on top of each other. And this is there for protection. So that's epithelial tissue. The second tissue type is connective tissue. And connective tissue basically does what the name says. It connects things together. It binds body structures together, holds them together. The best example of connective tissue that we have in the body is your skeleton. Your bones are connective tissue. They help hold you together. In addition to your bones, your tendons and ligaments also help to hold your body together. They are also connective tissue. The third tissue type is muscle. The combining form for muscle is myo. Muscle tissue contracts to produce movement. Usually when we think about muscle tissue, you think, or just muscle in general, you think of some meathead at the gym pumping iron, Arnold Schwarzenegger with his great big muscles. And that is a legitimate form of muscle tissue. That is skeletal muscle. Skeletal muscle are the muscles that you use on a daily basis. They're attached to your skeleton, which is why they're skeletal muscle. And when they contract, they cause movement. But there are two other tissue types or muscle types as well. We have cardiac muscle, which is found in your heart and only in your heart. It's a very specialized tissue type that allows your heart to beat a whole bunch without wearing out or getting tired or fatigued. And then you also have smooth or visceral muscle. This is found in all the hollow organs in your body. So again, take a minute, pause the video if you have to, and think, what hollow organs do you have in your body? How about things like your heart? Well, not your heart, that's cardiac. How about things like your intestines, your esophagus, your stomach, the arteries and veins, your bladder, the uterus? All of these have varying levels of smooth muscle within them. So the last of our tissue types is nervous tissue. The combining form for this is neuro. Nervous tissue makes up your brain, your spinal cord, your nerves. This is how your body communicates with itself, how we send electrical signals throughout your body to make sure your body knows what to do. Aside from just brain, nerve, and spinal cord, there is another cell type within the nervous system that does not send electrical signals, and that is this guy right here, your neuroglia, or just glia for short. For a long time, it was thought that neuroglia are just kind of the helper cells of the nervous system. They clean up waste products, they make sure your nerves have plenty of food, they get rid of old dead neurons, and that was kind of the understanding of how they worked. Since then, and within the last, I'd say 10 years in particular, we've started to really develop our understanding of the neuroglia. They do more than just follow your neurons around and take care of them. Your neurons are very needy, as they are. But the neuroglia also do things like listen in to the conversations that your nerves are having in order to enhance those conversations. They pay attention to which part of your brain is very active, and they activate the blood vessels to bring more blood to that area. They help to fight off pathogens, bacteria, viruses, anything that would cause an infection in your brain. So we're starting to learn that neuroglia do a whole lot more than just follow your nerves around and clean up after them. And this is a big focus in neurological research. This is where some of the really big discoveries are going to be made in the next 5 to 10 years or so, will be the neuroglia. The neuroglia are also usually a cause of a lot of our chronic diseases of the nervous system. So if you've heard of diseases like, for example, multiple sclerosis, there's a lot of multiple sclerosis in the US and in the Northern Hemisphere. There's a lot of research and hypotheses going into this is not a disease of the nerve specifically, but this is a disease of the neuroglia. The neuroglia have become broken somehow, and that's what causes the symptoms that you see with multiple sclerosis. Some evidence that Alzheimer's is a disease of the neuroglia, not necessarily just a disease of the neurons. So really interesting field, lots of research that's being done in there. Membranes are the simplest type of tissue. There are lots of different types of membranes. Mucous membranes obviously secrete mucus. Mucous membranes are found anywhere that the inside of the body comes in contact with the outside world. So the tissues inside your mouth, inside your nose, those are mucous membranes. Your gums, those are mucous membranes. If you go in the bathroom, pull down your eyelid and look at that little pink tissue underneath your eyelid, that's a mucous membrane as well. Serous membranes make a watery fluid, serous watery fluid. They line your body cavities. You have the peritoneum in the abdomen and the pleura in the thorax. And they cover over the organs. They support them and hold them in place. And then you have fibrous membranes. These wrap around the outside of an organ. If you were to look at a heart, for example, a real heart, you would see a fairly tough fibrous covering on the outside of that heart. That would be a fibrous membrane. Mucous membranes are particularly important in general medical diagnosis because they can give you a general good idea of how well your patient is hydrated. So do this for a minute. Pause the video, go to the bathroom, take a look at your gums, and take a finger and push on your gums until they blanch, until they turn white. And then let go and see how long it takes for the color to return to your gums. This is called capillary refill time, and it should take less than 2 seconds. If it takes more than that, your patient is dehydrated. Something has gone very, very wrong. They don't have enough blood for whatever reason. They don't have enough fluid in their body. So go take a quick look at that. Mucous membranes are a very nice way of determining how well hydrated your patient is. All right, several tissues that work together form an organ. Organs are composed of 2 or more tissues. And we group all of our organs into systems. Take a minute, see how many systems you can think of. We're going to talk about all of the body systems in our anatomy and physiology class. These would be systems like the digestive system, the urinary system, the respiratory system, even the integumentary system that we're going to talk about in a little bit. All of your systems have a very specific function, and they all work together. They all need each other. And this can be easy to forget because this anatomy class talks about each system individually. We'll go over the integumentary system in the next lecture, and then we'll talk about the musculoskeletal system. Eventually, we'll talk about the endocrine system, the reproductive system, the respiratory system. But if one system is not working properly, the rest are going to have issues as well. As a rather severe example, if the respiratory system is not working, the rest of your systems are not going to work and you are going to die. Or if your cardiovascular system, for example, is not working properly, the rest of your systems will not work and will die as well. The goal of all of your systems working together then is homeostasis. And homeostasis simply means a state of unchanging. Your body doesn't like to be at extremes. And a good example of this is temperature. Think about the last time that you went outside, it was very, very cold. Maybe if you were here during that crazy bomb cyclone that we had last year, you get kicked outside to go shovel snow by your mom. When you're out there, you get very cold. And what does your body do to raise your body temperature back up so you don't get hypothermia and die? You start to shiver, right? And that brings your body temperature back up to where it would normally be. Now think about, 3 months from now when it's the middle of August and 110 degrees outside, hopefully not, and you go outside and you get very, very hot. What is your body going to do to address that high body temperature? You're going to sweat, and the evaporation of that sweat will help cool you down, and your body temperature will return back to that normal 98.6 degrees. If something goes wrong in either of these and your body temperature gets too high or too low, that can cause some pretty severe organ damage and eventually can kill you. So the whole point of all of your systems is to keep you in this unchanging state of balance, this homeostasis. And again, that would be a very good definition to know for the upcoming quiz. Okay, lots of combining forms here that refer to cells and tissues. There are a few that I would point out in particular, histo and histio, for example. Both of these refer to tissue. Please do not confuse these with, and I'm sorry my writing is a little goofy, H-Y-S-T-E-R. Do not confuse histio with histero. These are not the same thing. Histo or histio refer to tissues, just in general. Histero refers to, take a minute, think about it. Histero refers to your uterus. So do not confuse the two, otherwise you'll send your male patient to go get a hysterectomy and you'll send your female patient to go talk to the pathologist about her prostate biopsy, and it'll be a bad day in the lab for everybody. So make sure that you're very careful with those. The other one that I would point out is up here, site or cyto. Site means cell. Make sure that you do not confuse that with cysto, C-Y-S-T-O. Cysto does not refer to cells. Cysto refers to your bladder, either your gallbladder or your urinary bladder, usually your urinary bladder. So another pair that would be very good to not mess up. Other things to point out in here, morpho refers to simply the form or the shape of a cell. Karyo and nucleo both refer to the nucleus. One is Latin, one is Greek. Adeno refers to a gland, just in general, any kind of gland. It could be a sweat gland, it could be an oil gland, it could be an endocrine gland, like maybe your pancreas. This is another one that it can be very easy to mix up. Do not confuse adeno with adreno, A-D-R-E-N-O. Adeno refers to any gland in general. Adreno refers specifically to your adrenal gland. Other roots that we see on here, both mixo and muco refer to just mucus in general. Anything with some refers to a body. A chromosome is literally a small body that takes up color. That's what chromo means. Chromo means color when you dye it. Blast is one that I would definitely know for the quiz. A blast is an immature cell. I always tell my students B for blast and B for baby cell. If you have a histioblast, that's a brand new little cell that's making tissue. If you have, say, a leukoblast, that is an immature white blood cell. So definitely know that one for the test. I would know trophy as well, tro for trophy. This refers to any number of things: growth, feeding, development. We will talk about muscular dystrophy when we get to the musculoskeletal system. Atrophy is wasting away, lack of tissues. That prefix A in atrophy means without, right? So without growth or development. A few suffixes that you'll see when we talk about chemistry. Anything that ends in ase, A-S-E, is an enzyme. Anything that ends in ose is a sugar. Hydro refers to water. Hopefully that's fairly familiar. You hear about dehydration or rehydration. Gluco and glyco both refer to glucose. Glyco you can also see just referring to sugar kind of in general. Saccharose also refers to sugar, amylose specifically to starch. We saw lipo already. Adipose, steato also refer to fat, and then proteo obviously to protein. These are some key terms here. I will let you read through these on your own time. These will be so very, very helpful while you're studying for the test and while you're working on your term words for your homework. Definitely take some time, make sure that you're familiar with all of these terms and all of their definitions. Some more combining forms here. The ones that I think are particularly pertinent to point out: chromato versus chrono right here. Chromato refers to color, chrono refers to time. Make sure that you do not get the two of those confused. We have aero that talks about gas or air. Something that needs air is aerobic. Baro refers to pressure. You might have a barometer in your house that measures the air pressure. Cryo is something that's cold. Electro, obviously referring to electricity. And then ergo, you may have seen before when you talk about something that's ergonomic, like an ergonomic keyboard or an ergonomic mouse, for example. Something that lets you work without damaging yourself. Some more physical combining forms. Phono refers to sound or to your voice. Think about your telephone. Photo is light. Radio refers to radiation, or it could refer specifically to an X-ray. The combining form sono refers to sound, and then thermo is any kind of temperature or heat. If you have hypothermia, your body is at an abnormally low temperature. If you have hyperthermia, your body is at an abnormally high body temperature. There's some terminology to know when you're talking about physically examining your patient. Inspection is just visual examination. Look at your patient. What do you see? Are they bleeding somewhere? Are they passed out? Do their gums look bright blue? Any number of things. Palpation is touching the body surface with your hands or with your fingers, usually to feel. Maybe your patient has a lump and you're palpating it to feel. Is it hard? Is it firm? Does it move? Is it tender? That sort of thing. Percussion is tapping the body to hear the sounds that the body makes. You would do this a lot on, say, the abdomen, tapping the abdomen to hear what sounds echo back from there. That could tell you if, say, your patient had fluid, abnormal levels of fluid in their abdomen. Auscultation is what you usually think about when you think about listening to sounds the body makes. This is listening to any kind of sound the body makes. Usually when we talk about it, we're talking about the heart. Think about going into the doctor. They put the stethoscope on your chest to listen to your heart. They stick it on your back to listen to your lungs. Both of those are examples of auscultation. You can also do this when you're listening to, say, sounds that the intestines are making. And when you learn to take blood pressure, you'll be doing auscultation when you're listening to the sounds of blood going through the arteries to determine what your patient's systolic and diastolic blood pressures are. Vital signs are information that should be taken anytime your patient comes in. This is the stuff that they get right off the bat when you show up at the doctor. So temperature, obviously. Your patient's temperature should be 98.6 degrees Fahrenheit, 37 degrees Celsius. Your pulse rate is measured in beats per minute. Usually you'll count how many heartbeats your patient has in about 15 seconds. And then multiply that by 4. That should give you a good pulse rate. Respiration is measured in breaths per minute, should be between 12 to 20 for a healthy adult. Pulse rate should be between about 60 to 80 for a healthy adult. And then blood pressure. This is the pressure in the arteries when the heart is contracting and the pressure in the arteries when the heart is relaxing. Your systolic blood pressure is blood pressure when the heart contracts. Diastolic is blood pressure when the heart relaxes. You will always write it, as you see down here in the corner, systolic over diastolic, and it should be, the systolic should always be higher than the diastolic. If your patient comes in and their systolic is 100 and their diastolic is like 250, they're going to have a very, very bad time in the ER. Something's gone wrong. Tools that are used for examination: an ophthalmoscope is used to look into the eyes. This combining form ophthalmo refers to the eyes. An otoscope, oto refers to the ears, so this is used to look into your ears. That suffix on both of these, scope, that we see, is a tool that's used for visualization. You use a hammer for testing reflexes. Usually when you think about hammers and reflexes, you think about going into the doctor and the doctor whacking your knee with the little hammer. And that is the most common form of reflex testing that you'll see. But there are other reflexes in your body. Most of them are very, very subtle. You have similar reflexes that you can tap on in your elbow, in your wrist, in your ankle, behind your knee. These are not commonly done. You'll do them if you suspect some kind of neurological damage. And then last of your tools is a sphygmomanometer, which is a fun word to say 5 times fast. A sphygmomanometer is just a fancy word for your blood pressure cuff. You guys will learn how to use the lazy person's button pushing blood pressure cuff. You'll also learn how to use the old school blood pressure cuff that you pump up and listen to the sounds in your patient's arteries. This is how you'll measure blood pressure. I talked about a scope a little bit. Scope just simply means a tool for visualization. An endoscope is used to look inside the body. So this combining form endo right here This just means inside. Anything with in, either in or en, refers to something interior or inside. So an endoscope is used to look at the inside of body cavities. The example that we have in this picture right here is a bronchoscope, specifically used to look into the lungs. But in theory, if there's a cavity in your body, you can stick a camera in it. You could have a gastroscope that looks into your stomach. You could have a cystoscope that looks into the bladder. You could have a hysteroscope, a camera that's put up into the uterus. You have a sigmoidoscope if you go in to have someone look at your colon. Anywhere that you have a place to put a camera, there is a scope that is made for it. Biopsy is often done with the use of an endoscope. This is removing a tissue to look at it microscopically. It could be we're looking at it to see if maybe your patient has an infection and we're trying to figure out what the infection is. Maybe you suspect cancer, so we're trying to figure out, is this tissue cancerous or not? Any number of things. You get tissue for biopsy a bunch of different ways depending on where the tissue is and what you want to look at. You can do needle withdrawal, so maybe your patient has a little cyst and you draw some fluid out of that cyst to take a look at it. A little punch biopsy, which kind of looks like a little 3-hole punch or a little 1-hole punch, where you would punch part of tissue out of someone. You do this with the skin sometimes if you suspect your patient has skin cancer. Endoscopy. I will put up a video that shows endoscopy being used for a biopsy in the lungs. And then you may just do surgical removal. Say you have a patient, you think that they have a brain tumor. You saw something really scary on the MRI. You would open them up, go in, pull out that tumorous tissue, and then send it off to pathology to have them look at it and tell you what it is, if it's cancerous or not. Treatment is always dependent on the diagnosis. The way that you're going to treat something depends on what's actually wrong with your patient. And it can be any of the following, any combination of them. It could be counseling. Usually when we think of counseling, you think of like lying on a couch, holding a pillow, telling somebody about your deep, dark secrets. And that is a legitimate form of medical treatment, but counseling can also look like different things. Maybe you just found out that your 3-year-old has type 1 diabetes. Oh my word, what do I do? How do I take care of my kid? How do I test their blood sugar? What do I feed them? What can't I feed them? Or maybe you just found out that you have HIV. Terribly sorry, you're having a bad night. Oh gosh, what do I do? What medications do I take? How do I keep myself safe? You would go talk with a nurse educator and they would counsel you on how to take care of your kids' type 1 diabetes, how to take care of your HIV, any number of things like that. Drugs are obviously the treatment of choice that we think of when we think of treatment. Surgery, if you think of something like anything from a broken bone to cancer, radiation, usually used in cancer treatment. And then physical therapy versus occupational therapy. What is the difference between these two? So physical therapy is used to regain strength, range of motion to a part of the body that's been injured or damaged. Let's say you fell down and went boom and you broke your leg and you had to be off of your leg for, 3 months, really bad break. When you get your cast off, you'll go to a physical therapist, and that physical therapist will help you regain strength and range of motion and mobility in that leg and make sure that you don't hurt that leg while you're trying to regain strength and mobility and range of motion. Occupational therapy is a little different. Occupational therapy looks at how can our patient interact with their environment safely. So let's say you have a patient who had a stroke. They're probably going to physical therapy and occupational therapy at the same time. The physical therapist is working on them getting strength and mobility back in the half of their body that was paralyzed from the stroke. The occupational therapist is working on how can this patient stand up at the counter to make breakfast? How are they getting around their house? What about stairs? What do they need to have focus on for that? So 2 very different types of therapy, a lot of overlap between the 2 of them. And then, of course, our last treatment that we have listed there, psychiatric treatment, which could be done with any combination of the above. The follow-up for treatment is a prognosis, and prognosis is prediction of how this disease will end. And prognosis looks really different depending on different diseases. If your condition is, say, strep throat, your prognosis is probably take all of your antibiotics, and if you don't feel better in about 3 days, call me. If your diagnosis is something like glioblastoma, brain cancer, your prognosis may be, well, we'll do chemotherapy and radiation and see what happens. If your diagnosis is something like mental illness, maybe bipolar or schizophrenia, your prognosis may be something like continue to take your medication, make sure that you're seeing your psychiatrist regularly. So this will look very, very different depending on what's going on. These are a few suffixes that we see with diagnosis and diagnostic tools. I would be very, very comfortable with these three, graph and graphy. So a graph is an instrument that's used to record data. They have the example there is a polygraph, what you would commonly call a lie detector. You use an echocardiograph to look at the heart. Graphy is then the actual act of recording data. So you use the graph to do graphy. So polygraphy would be using the lie detector. Echography would be using an ultrasound to see what's going on in the body. Gram then is the little piece of paper with the information that the instrument spits out. So you sit your patient down to do a polygraph. You go through the polygraphy, the act of giving the lie detector, and then you get a polygram, which is the readout that the lie detector test gives you. We see the same thing here with meter and metry, scope and scopy. A meter is an instrument that's used to measure. The act of measuring is metry. I like this audiometry here. That's your measurement of hearing. Doing the measurement of your hearing, you would use an audiometer for that. And then scope and scopy. Like I said, a scope is an instrument that you use to visualize or to see the inside of something. Scopy is then the actual act of looking at whatever you're looking at. Some more suffixes here. Synthesis refers to any puncture or tap. You may have had like an amniocentesis if you've ever been pregnant, taking the great big needle, putting it in the uterus to get amniotic fluid. The suffix desis refers to binding or fusion, something binding together. Ectomy, this little suffix right here, is surgical removal of something. You've probably heard the word hysterectomy, right? Someone going in to get their uterus removed. I always tell my students, the easiest way to remember ectomy, if you have something icky inside of you, it needs to come out. So you will have an ectomy to get that icky thing out of your body. Taxi refers to surgical fixation, and I don't mean fixation like fixing or repairing something. Surgical fixation is sewing something in place so it won't move. A really good example of this is in dogs. You see this condition called GDV, gastric dilatation volvulus. Their stomach fills up with gas, and then it rotates on itself and twists so that it twists off the intestine and the esophagus on either side. To fix that, you have to go in, unrotate the stomach, and then while the vet is in there fixing that, they will usually do a gastropexy and sew the stomach to the wall of the abdomen so it doesn't rotate on itself again. This is not the same as a plasty. That's what you want when you think about surgical repair or plastic repair of something. The example that they have here is a rhinoplasty or a nose job, but you can do plasty for anything that you need to repair or reconstruct. Our suffix raphy down here also refers to repair specifically with suturing, sewing something back together. And remember those suffixes that start with RH. What's our rule about them? Stomy refers to creating an opening in something. A tome is then the instrument that you would use to make that opening. And then tomee is the act of making the opening, just in case those three weren't confusing enough. This suffix here, tripsy, I would get to know this one because you'll see it a fair amount. refers to crushing or cutting something. You see this when we talk about kidney stones. You do a lithotripsy and crush those kidney stones so they can be passed. All right, so let's jump into the second half of the lecture, which is all about our directional terminology. How do we talk about where things are specifically located on the body? So here are our objectives for this half of the lecture. As always, if you feel comfortable with these, you should do very nicely on the quiz. So anatomic position, why are we talking about this? Anatomic position is our kind of starting reference point for whenever we talk about where something is located on the body. And this is, if you, on the other side of your computer screen, will stand up. So standing nice and tall, feet parallel, toes pointing forward, arms at the side, palms facing forward, chin parallel with the ground. This is our anatomic position. And it's important that you're able to take your patient and kind of mentally unfold them and put them in anatomic position. Imagine if you had, say, a patient come in with a gunshot wound. They're not going to stand there in triage in nice, pretty anatomic position while you look over them and see where they got shot. They're probably going to be crumpled in a ball on the gurney. And it will be up to you to kind of mentally unfold your patient and put them in anatomic positions. You'd be able to tell the doctor, the bullet wound is, just inferior to T4 or wherever it may be. These are all the directional terms that we will go over. Some of these have multiple words for the same meaning. We'll touch on all of them. For some of them, the words are more commonly used in, say, veterinary medicine than human medicine, but it always pays to have a broad vocabulary. So let's start with the first. How do we talk about something that's closer to the head versus something that's farther away from the head? So something that is superior is located closer to the head or more towards the head. You also hear the word cephalic used. Cephalic's not super common in human medicine, but you will hear it occasionally. The example that they give here is that the eyes are superior to the mouth. The eyes are located above the mouth. So the opposite of superior or cephalic is inferior or caudal. Think, for example, if you feel like you're superior to someone, that means that obviously they're inferior to you. The word caudal comes from the Latin word cauda, which literally means tail. So something that is caudal is located closer to your tail. The example that they give you here is that the knee is inferior to the shoulder. The knee is located below the shoulder. Now, hopefully you've noticed pretty quickly that these terms are comparative. You would never say the knee is inferior. Just like you would never say, this grade is better. Well, this grade is better than what? Is it better than the A that you got on your last quiz? Is it better than the quiz that you failed because you were up all night on, Disney Plus? In the same way, you would never say just the knee is inferior. It's always going to be compared to something. The knee is inferior to the shoulder, or inferior to the ribs, or inferior to your hip bones. So keep that in mind while you're using directional terminology. Ventral or anterior refers to something located towards the front of the body. You'll more commonly hear the term anterior used than ventral. The example that they have here is that the navel, your belly button, is on the anterior surface of your body. Also, your lungs are ventral to your spine because your lungs are closer to the front of your body than your spine is. Your spine is on the back of your body. The opposite of that then is dorsal or posterior, and posterior is more commonly used in human medicine. Something that's located towards the back or along the spine is posterior. Your spine is posterior compared to your lungs. Your spine is about as posterior or dorsal as you can get. Now, median versus medial are two very similar sounding terms. Make sure that you're paying careful attention to them, though. If something is median, it's located on a midline. Think of the median in the road, the concrete barrier or the little strip planted with shrubs and trees in the middle of the road. That's the median, the midline of the road. Something that is medial then is closer to that midline. And you have a midline running through you as well. You have a line that gives you even left and right halves. Something medial is located closer to that line running through the middle of the body. This would be something like your nose or your mouth. Those are both pretty medial because they're right on that midline that goes through your body. Your belly button is a good example of something that is a medial structure. Something that's located farther from the midline of your body is lateral then. Your ovaries are located lateral to the uterus is the example that they have here. Your ears are lateral to your nose because your ears are located farther on the side than your nose is. Your shoulders are lateral to your collar or to your sternum, your breastbone. Now, proximal and distal are used only for limbs, only for arms or legs. You would never use proximal and distal for the torso, for something closer to or farther from the head. Because proximal and distal are measured from the point of attachment. Where does the limb attach to the body? Obviously, in the arm, the point of attachment is the shoulder. That's where the arm attaches to the body. In the legs, the point of attachment is the hip. That's where the legs attach to the body. The example here is distal. The hand is distal to the elbow. Something that is distal is farther from the point of attachment. So your hand is farther from your shoulder than your elbow is. That's what they're getting to here. You could be even more specific. You could say your fingers are distal to your wrist because your fingers are farther from your shoulder than your wrist is. The opposite of that then is proximal. Something that is located close to your shoulder is proximal. The example they have here is that your elbow is proximal to your wrist because your elbow is closer to your shoulder than your wrist is. We could say that your humerus, which is this guy right here, your upper arm bone, is proximal compared to your radius, this bone down here in the lower arm. Superficial and deep, hopefully, are kind of self-explanatory. Something that is superficial is located toward the outer surface of the body. Your skin is just about as superficial as it gets. That is the outer surface of your body. Another example that you could have is that your ribs are superficial compared to your lungs because your ribs are closer to the outside of your body than your lungs are. Your lungs are underneath inside your ribs. The opposite of superficial then is deep. Something that is deep is located towards the center of the body. The example they have here is that your heart is deep compared to your ribs. Your heart is more towards the inside of your body than your ribs are. Everything is deep compared to your skin. There are a lot of positions in which you can put a patient for procedures, for diagnosis, any number of things. If you put your patient on their back, palms down, looking towards the sky, we call this the supine position. If you were to take your patient then and flip them upside down and lay them on their belly with their back up, this is the prone position. So here we have a bunch of combining forms, some roots for talking about the head and the trunk. There are a couple that I would point out that you should know: cephalo and cervico. Cephalo refers to the head, cervico refers to a neck. And usually when we talk about cervico, my students suddenly have questions about, wait, doesn't this refer to the cervix of the uterus? And it does, because the cervix of the uterus is the neck of the uterus. Think like the neck of a bottle. You have two cervices. One is in the uterus, and then one is just your neck. The vertebrae in your neck are called your cervical vertebrae. When we talk about extremities, acro refers to any kind of end. Brachio is your arm. Dactylo is your finger or toe. And then pedo or podo, both of these refer to your feet. Planes of section refer to how we can cut the body into divisions to give us different halves of the body. We have frontal planes, coronal planes, or frontal planes, sagittal planes, and transverse planes. The frontal plane is also called a coronal plane. No, this is not referring to the Mexican beer. Coronal means crown. A frontal plane gives you a front and back half of the body. So imagine if you had a crown that you put on your head and it suddenly cut you in half to give you a front and back half of your body. A sagittal plane divides the body into left and right halves. A mid-sagittal plane goes right down the middle of your body and gives you an equal left and right half, but you could have a sagittal plane that's off of the midline, maybe a sagittal plane that just cuts through, say, your shoulder and your hip. That would still be sagittal because you'd still have left and right parts of your body. A transverse plane divides the body into top and bottom, superior and inferior, and this may be the plane that you're more familiar with because if you have ever seen a CT or an MRI, this is usually the plane that we use to do that diagnostic technique and look at the body. So here are our different planes of section. You can see the frontal plane that's giving you a front and back half, the sagittal plane that cuts your patient's body in half, and then a transverse or a horizontal plane that gives you a top and a bottom half. Now regarding body cavities, a cavity is just simply an empty space. So if we were to take a body, scoop all the organs out of it, we'd probably have a prop for narcos, but then we would have two big main holes in the body. It would be empty, we'd have a whole bunch of empty space. And these two main cavities that we'd find are dorsal, remember dorsal refers to the back, and your ventral cavity. And within this dorsal and ventral cavity, we find a few other cavities as well. So, for example, here are your dorsal cavities. Back here. You have the cranial cavity up in the head, which contains your brain, hopefully, and then the spinal cavity running through the spinal column, which contains your spine. And since both of those are on the back of the body, they make up entirely the dorsal cavity. The ventral cavity, then, is everything in the front of the body, and maybe a little more easy for you to kind of imagine. So you have the thoracic cavity, which is the top half of the body underneath the ribs and above the diaphragm. Remember, the diaphragm is the big sheet-like muscle that sits right underneath your lungs and moves and helps you breathe. Below the diaphragm, you have the abdominal cavity and the pelvic cavity. And because these two meld into each other, we usually just call it the abdominopelvic cavity, one huge big cavity. Think about organs that you find in these cavities. In the thoracic cavity, we would find something like the lungs, the heart. In the abdominal cavity, lots of digestive stuff, stomach, liver, intestines, the kidneys as well. In the pelvic cavity, the urinary bladder, the prostate, the uterus, things like that. Be familiar with which cavities are dorsal and which cavities are ventral for the quiz. So like we just talked about, the dorsal cavity has your cranial and spinal cavity that contain the brain and the spinal cord. And the ventral cavity has the thoracic cavity, which has heart, lungs, trachea. The diaphragm separates the thoracic cavity and the abdominopelvic cavity. And then below the thoracic cavity, we have the abdominopelvic cavity, which has your abdomen, your abdominal cavity, your pelvic cavity, and then this peritoneum, which is a membrane that lines the inside of the abdominal cavity and holds some organs there in place. The equivalent of that in the thoracic cavity is the pleura. Now, because the abdominopelvic region of the body is so big, we like to divide it into sections to make it easier to talk about different parts of the abdominal region. So we can draw two lines down the middle and two lines across the side and divide it into 9 regions. And we'll take a look at this right here. So if we go down the midline, we see up at the top the epigastric region. The prefix epi means above or on top of. Gastro refers to the stomach. So this is the region right above or on top of the stomach. The middle region, right below the epigastric region, is the umbilical region. Hopefully that's self-explanatory. You all have an umbilicus from when you were chilling in a uterus. Below the umbilical region is the hypogastric region. Hypo means below or beneath, and again, gastro refers to the stomach. So this is the region far down below the stomach. So those are our three midline regions. After that, on either side, we have left and right regions that are named for anatomical landmarkers. And a word about our left and right before we go any further. Whose left and right are we referring to here? Hopefully you've noticed on this picture that left and right are backwards. Your right does not correspond to this patient's right. And that's because whenever we talk about left and right anatomically, we're always talking about the patient's left and the patient's right. So this looks flipped and it should be flipped. Make sure that you're paying careful attention to that whenever you have to label something in the body. So looking at our left and right sides, up on the top we have the left and right hypochondriac region. Hypo, hopefully you remember from the first lecture, hypo means below or beneath, and then chondro, C-H-O-N-D-R, refers to cartilage. And hypochondriac specifically means this cartilage right here that's holding the ribs onto the sternum. So these are the areas of the abdomen that sit beneath or below that cartilage of the ribs. Moving down, we have the right and left lumbar regions. Lumbar refers to the lumbar vertebrae, which are the 5 big vertebrae in your lower back. So that's where these regions get their name. And then down one more, we have the left and right iliac. These are referring to, iliac refers to a bone of the pelvis that runs right along here called the ilium. So left and right iliac are named because they sit right next to the ilium of the pelvis. So that's where we get all of these names for these different sections of the abdomen. Now, usually you'll see people do quadrants of the abdomen instead of our 9 divisions of the abdomen just because it goes a little faster. To do quadrants of the abdomen, you just simply draw a line straight down and straight across that intersect at the navel. And then you have a right upper quadrant, a left upper quadrant, a right lower quadrant, and a left lower quadrant. And that is a lot faster if you need to be quick about diagnosing, saying your patient has pain, say, in their right lower quadrant, or your patient has pain in their right upper quadrant. Like I mentioned before, make sure that you're paying attention to point of view. Who's right? Who's left? Make sure that you are always labeling on the patient's right and the patient's left. So a few little prefixes here talking about direction. You'll see there's some overlap here. Both circum and peri mean around or surrounding. Our prefix intra means within or inside. Epi is one that you should definitely commit to memory. You'll see it a lot. Epi means above or on top of or over. Extra refers to something outside. Think of our word exit that has the same root in it. And then infra indicates something below or beneath. These are our abbreviations for our quadrants, LLQ for left lower quadrant, LUQ for left upper quadrant, and then the same for right as well. So hopefully this has been a good overview for you of our directional terminology, how we talk about parts of the body. As always, if you have questions or would like to go over anything, definitely shoot me an email and we can chat.